to our CDR session. We're really pleased to welcome today's session delivered by Dr. Nahid Rezwana from the University of Dhaka. She's a professor in the Department of Geography and Environment there, and her research spans several different themes. She looks at disasters, vulnerability, gender-based violence, health, as well as a number of different kind of social inequalities and how those intersect to make certain people perhaps more vulnerable in the face of disaster. Today, she's going to be talking to us about a fascinating research project in progress, which she's undertaking with Professor Rachel Payne from Newcastle University. So they've actually completed a lot of the research on this particular project, and they are launching into writing, I think, as we speak. So we will definitely stay tuned and we'll be very interested to read the paper that comes out of this. But the working title of the paper is Coping with COVID-19 and Floods in a Disaster-Prone City of Bangladesh, Place Attachment and Immobility. So with that, Nahid, I think I'll hand over to you. We're really looking forward to hearing from you.
Thank you, Ansley, for inviting me for such an important seminar. I am Nahid Rezwana, working as professor in the Department of Geography and Environment, University of Dhaka. And with me, Professor Rachel Payne. She is the Dean of Social Justice, Newcastle University, United Kingdom. We have completed a research recently, which is titled as Coping with COVID-19 and Floods in a Disaster-Prone City of Bangladesh, Place Attachment and Immobility. And this project was funded by Christopher Moyes Memorial Foundation, located in United Kingdom. I have divided my presentation into several points, and actually I will start from the introduction, introducing my study area. The study area is Sariakandi municipality, which is situated in Bogura District, Rajshahi Division of Bangladesh, and this municipality is surrounded by rivers, two mighty rivers. One is Jamuna and another one is a Bangali river. The municipality actually struggles with poor roads and drainage system, limited access to healthcare and education, and the absence of basic services like gas supply and waste management. Residents regularly face natural disasters such as flooding from the rivers, along with ongoing riverbank erosion. On top of these difficulties, the COVID-19 actually further strained the economic and health conditions of the people living there. So I would like to draw your attention to the background of this municipality, which is located in Sariakandi Upazila, or we can call it sub-districts, is one of the 29 areas in Bangladesh that are most vulnerable to riverbank erosion. And the inhabitants, actually, the Sariakandi Upazila confront a great deal of inland riverbank erosion, primarily caused by annual flooding, and also they face disastrous floods that occur every 3 years or so. So people actually from those riverbank eroded areas, they migrate to small town, but they try to move to the nearest town and area in search of fresh homes and employment opportunities. According to a field survey conducted by Amin and his team in 2024, 84% of the disaster-affected people in Sariakandi Upazila migrated to the nearest town, which is actually Sariakandi municipality, and nearly 49% of them came here, and only 16% of them relocated to Dhaka, the capital of Bangladesh. Let me explain this background. Actually, we can see from there that this is Bangladesh, and these are the 8 divisions of Bangladesh, and this is Rajshahi, and this is Borishal. Why I'm locating that these two divisions? Because from these statistics we can see that out-migration is highest in Borishal division, whereas Rajshahi division is second position in regards of out-migration, which is 6.14. The question is that why people from these divisions do not move to other divisions, or internal migration is not happening there. Because from this diagram, we can see population displaced due to natural disaster. We can see there that Rajshahi division only they move within the districts only 0.52. So comparing other divisions, we can say that the internal migration is not happening. Internal migration, I am trying to focus on internal division. They are not moving from from their area. So the present study aims to know how the residents of this municipality cope with these different disasters and why exactly they do not migrate to safer locations from this vulnerable city. So we had objectives. We had three objectives: to analyze the impacts of disasters on socioeconomic condition, health and well-being of the studied community, to identify any applicable local knowledge and disaster coping strategies, and to analyze and identify the context and factors of immobility, if it is voluntary or involuntary, and their migration trend. So we have actually, our methodology was mixed research methodology, and we have applied different methods. First of all, we have conducted a household survey. We have gone to 250 households, and we have collected data on basic information like education, economic condition, healthcare, health impacts, healthcare access, and disaster. We try to focus on disasters as COVID-19, and they also had a flood in 2020. It was in May, so they faced two disasters at a time. So we have covered those disasters too and their impacts. So after getting these statistics on household survey, we have found that there are lots of the statistics I'm going to discuss later, but to get our answer why they do not move from these very disaster-prone area city, we have applied four quantitative methods. And first of all was key informant interviews, then in-depth interviews, focus group discussions, and observations. We talked with doctors. We talked as a key informant interviews. We had interviews with doctors, school teachers, madrasa teacher. We have homemakers, and the people who daily laborers, and we also talked with students. Yeah, we talked with them. So what we have got from these key informant interviews, that we got the data, and also we had 45 in-depth interviews. We applied snowballing methods, and actually we carried on the in-depth interviews until it got the saturation point, and the number was 45. We conducted two focus group discussions with female group and male group, and we have found that they have the similarity, and we could have completed triangulation. Observation was very important for this research, because I have visited the area several times. I spent time with them. You can see from this photograph that we are sitting just beside mighty Jamuna River, and it was a winter time, but still the river, we can see the wideness of this river. So after analyzing the impacts of disasters, we have found that first of all, I'm going to talk about health impacts. And the study presents that 94% of the residents reported sickness from various diseases during the survey in 2024. The common diseases mentioned are diabetes, blood pressure, skin diseases, and different types of pain. We have asked about COVID-19, and we found that 88.93% of the respondents experienced health problems. It is cold and fever during that time, but only 11% of them took the test. So we don't know actually that if they had COVID-19 or not, but they were suffering from cold and fever, and we asked about it. So only 2 people are reported to have died due to COVID-19. In flood 2020, they also got flood-related health problems, and that was diarrhea and skin disease. They have separated these 2 diseases, and health impacts varied by group. 94% of children and more than 58% of women and 34% of men were affected by these health problems due to a flood. And we can so these health impacts, what they do when they get sick. We have asked them that where they go, where they prefer to visit first, and Upazila Health Complex is the main source of treatment for these residents. Nearly 89.52% of the residents mentioned that they first visit Upazila Health Complex. I would say that maybe the last, because they actually, after these health complex, whatever they get, the facilities, the treatment, they do not, most of them do not go further. They do not go to other healthcare facilities, and they have only few clinics there. And if they want to have the treatment, they have to full treatment, they have to go to the district towns. So the question is that what they get from this healthcare center. Actually, this healthcare center, there is no provision for emergency treatment, no operation facility, and ICU. We can see from a quotation, a female doctor was saying that the medical equipment is very poor. I have to take oxygen cylinder from one patient to another based on his condition, even though I am aware that he will feel better if I give him more time. However, I must care for each patient. This is really difficult. It makes me sad. And she was explaining that how she faced COVID-19 when many people came for the treatment, and she did not have that enough equipment. So actually during normal time, even they do not have the facility for a cesarean for child delivery. They can only they can help with the normal delivery. So they actually, what I'm trying to say, that they do not get full treatment in most of the cases. So what they do, actually, they buy medicine with from the local drugstore most of the time without the advice from the doctor. So this is their health problems and healthcare facilities, what they get from this municipality. And now I'm going to discuss on economic impacts. Actually, the municipality residents faced economic challenges during COVID-19, and the number was 91.67%. And 44 of the residents who took out loans were unable to return the loans. Again, when the flood came, and the flood affects their economic condition, according to 84%, it is reported that 47% of them took loans during the flood in 2020, and 58% of them could not return the loan up until 2024. The lack of job opportunities and unemployment is a significant problem for this area. And if we look at the statistics, that 94.4% of the residents live below a means of 1.08 US dollar daily. So what they do, they take financial help like donation, aid, and mental support from relatives and neighbors, and they also receive relief from government and NGOs, which is insufficient and irregular. Now, I would like to emphasize on the impacts of education. Actually, education level of this municipality, the residents, the illiteracy rate is not very good. According to Bangladesh national statistics, 81% is the literacy rate for the urban population, whereas over here only 67% went to school, and 10% have higher education, and 23% of them are illiterate. And if we look at the statistic, that 15% of the respondents left school, and 84 of them who left school due to financial crisis. And what happened during the COVID-19 pandemic period? 92.4% of the students encountered difficulties in their education, and among them, 80% of girls and 78% of boys stopped going to school. And actually, why they stopped going, why they stopped going to school? Because of the negative effects of COVID-19 on their health and financial situation. Now, if we look at the well-being, what happened? There were early marriage and the incidence of early marriage, and 60% of the respondents who discussed early marriage and dowry violence during disasters, they said that they had to pay dowry money to marry off their daughters. So this is the statistics of, these are the three sectors. I have finished the discussion on the impacts of the two disasters during pandemic time. It is flood and COVID-19. So how did they actually, it was a question that how do they cope with these disasters? They face every year, they face flood, they have riverbank erosion, but what they do? According to their what they answered, that living a hard life is the first coping strategy for them. They eat less, spend less money for daily necessities. This was mentioned, the first coping strategy was mentioned like this, that they try to take one meal a day, or two meals in a day, so that they can cut some of their daily expense. 15% have said that they try to cope with taking loans, and 10% said that they receive aids from relatives and neighbors, and some of them receive some aids from NGOs. But the question is that they did not mention that migration is one of their coping strategy, because migration is not a coping strategy for this resident, and it is not something they even consider. So we had a huge question that why, but let me explain first that what is happening there in regards of migration and immobility. First of all, I must say that Sariakandi municipality, as we have already known that it is located near two mighty rivers, so riverbank erosion was there. So this municipality actually received migrants from those areas. But the thing is that 75% of them during the survey said that they are living in this city for more than 15 to 50 years. And most of the residents though came from the other nearby locations, but when they came here and they started living there, they did not move. And during the pandemic, only 4% of the residents left the area, and 8% of the people entered the municipality. It means that the people of residents and their families who are living outside the municipality, they returned. So that was 8%. And the people who faced the economic impact of COVID-19, only 4 of them left the area. So it was a big question for us that why did not they leave the area? So the first major reason, that what they said, the major reasons of immobility is the loving this area and neighborhood and community bonds. And they said that this is the main reason they are staying in this vulnerable city. Place attachment theory actually helps to explain these phenomena, and we can see from this quotation that what they are saying, that I love my land, my occupation, we have fertile croplands, we get vegetables, we catch fresh fish from rivers. So I love living here. We have several problems, but still we love our land. We do not want to leave. And surprisingly, I would say that 43% of the residents are satisfied with their present financial condition. This is very surprising, because we asked them that, are you happy? Are you satisfied with your financial condition? And then they said yes. 43% were said yes. So this is a question that when they are expressing their feeling, they're saying like that they like this land and they want to be here. And when we did the gender analysis, and we found that gender analysis of the reasons of immobility highlights the complex interrelations between social reproduction, disaster coping strategy, and place attachment. Qualitative data reveals that female residents mostly prioritize the social benefits of living in this municipality, whereas male members mostly mention the risks of economic instability in leaving this municipality. Let me explain this. We can see from this photograph that these women, the women who are sitting, we can see from the photograph, they are not actually family members. They are neighbors, and they are having we can see that they are helping each other, they are having a good time. And when we are asking, they said that we'll live like this and we actually help each other. So from the quotation, what we see that we live by helping each other. And one female respondent was saying that if I don't have rice at home, I know she, my pointing at her neighbors, will give me some rice to eat. I will not starve for days. This is a very important thing, that they always feel safe that someone is there to help them. And they were saying, and I have spent hours with them, and I have found that they have such a good bonds. They share their, we can see this is yard, they're sharing their yard. They do their daily works together. When they are in a crisis, they help each other. So what they were saying, that we share our happiness and sadness, we help each other to survive the difficulties of disasters. So this is this we got from our qualitative method. When we applied qualitative method like in-depth interviews, we got this result. So now cost benefit analysis. Actually, Todaro model has explained that people try first do the cost benefit analysis, and they try to settle in a city without settle in a city, and then they try to stay there until they can get some money, they can survive there, and they start saving money. So what Todaro model has said, this research displays the reverse context. Let me explain. The resident assumed that a lack of acquired education and skill to survive in a new environment might negatively affect their present economic condition. They're afraid that they will not survive in the city, and they do not want to take the risk. From the quotation, we can see that they were saying that there is no financial benefit if we calculate. We need to pay house rent, buy every food items in a new city, whereas we do not have to pay for these facilities here. And they were saying that we help each other, we take care of each other, and I don't know anyone in a big city who is going to help me with money during a crisis. And actually, male residents were saying these things, and they were very cautious. That they were saying that you have to we have to pull rickshaw. We have to be daily laborers. When if we go to the migrate to the big towns and big cities, what we do, what we get, we have to spend the most of the money to survive there. So they said there is no financial benefit. Rather, they were saying that we can take one meal or two meals a day during disaster time, but still I'm happy that I'm with all of them, and I don't have to my economic condition, think about my economic condition so hardly that I will starve. So they were also saying that big city people are not always nice to us. I feel sad. I feel alone living in a big city. So all these things actually where when Todaro has said that in 1970 that people will take the risks, but I have found in this research people who talked with me, who discussed about their condition, they said that they don't want to take that risk, and they don't feel that there is any, they don't think that there is any financial benefit. Rather, they will stay in their land and spend their life. So another approach, system approach theory, if we look at this, I have checked this and tried to find out that if it helps me to understand the context, and we have found that negative feedback from the residents who left Sariakandi also enrich the local area adjustment mechanism in this municipality. Moboginje mentioned in his system approach theory as the rural adjustment mechanism. Let me explain that actually what Moboginje mentioned in his system approach theory, that we can see from, I don't know if you can see it properly. This was mentioned that if people urban adjustment mechanism, as if they get the negative feedback channels, it will come back to rural control subsystem, and rural adjustment mechanism will be increased. So from this quotation, we can see that they who has migrated to the capital city or others city, they have negative feedback actually. One quotation was like that my brother lives in Dhaka and he wants to come back after retirement. He doesn't want to live in Dhaka. Life is very difficult for him. And another quotation is saying that it is difficult to get jobs in big cities. The living condition is not good. We have to live in poor residential areas. That is slums actually, because when they come to to Dhaka, mostly they have to stay in slums, and we know that the residential facilities are not there in slums of Dhaka city. In most, I think that it is the same for the most of the slums in the world. And what happens that they miss the land, and they were saying that if we all these reasons, if we consider, and the place attachment theory, and then the Todaro model and system approach theory, all these, if we consider these theories, we will find that the voluntary immobility is common among Sariakandi municipality residents despite disaster risks. Actually, what happens that they think that they should be in their land, they should spend their days, they should struggle here, they should get whatever they get from this land, but still they do not want to leave, migrate from this their land. And this result got similarity to Blondin's study result in 2021 located in Tajikistan. Beside Blondin's study, there were several studies. It says that attachment to place encourages voluntary immobility. Actually, Sariakandi people, as residents, prioritize in situ adaptation with floods and riverbank erosion rather leaving the area. They depend on the community safety net to cope with disaster impacts and poverty. So we have asked them that what actually they want, because we have found that they are living below poverty line. Their health condition, they are suffering from different diseases. 94% reported that, and also the healthcare facilities, what they have in that area, is not enough for them. But they try to cope with these. They try to they live a hard life, like they don't take meals, they don't have the healthcare facilities. But whenever I should say a woman, I was asking, she was a young woman. They have started their family. She has a toddler, and her husband. They were living in municipality, and I have when I was visiting her house, I asked that what happened during 2020 flood. Then she was saying, "Oh, the flood river, the flood water came up until this level, and I have suffered a lot." But then I was saying that, what are you thinking? The Whenever I'm asking, then what is your future plan? What do you want to do? All the time she answered that she wants improvement in her own locality. Like she was saying that if I can get this much land, if I can get this facility, if the if the riverbank erosion can be stopped, if the flood water can be stopped, then we are happy. But never ever she said that I want to leave this area. I was asking that why don't you go to the main, the Bogura, the district city, the headquarters. I was saying that why don't you go there? She said that no, I just want to be here. So when we asked that what is your recommendation so to improve your life, they were saying that they proposed to help them improving the local environment, which will be which will be supportive to resilience against several disasters. And first of all, most of them said that improving the drainage and road system, because they suffer a lot during especially during flood. The road system doesn't work well and they have to suffer. And more healthcare centers, they were saying that they know that they're not having the full treatment what they need for their full recovery. So more healthcare centers and healthcare centers with facilities, actually educational institute, because I have found that many especially girls, they don't complete their education because they have to go far to get their education, higher education. So they want more education institute there. And of course, they said that employment opportunity are they requested that if it is possible to increase the employment opportunity. Any factory or any institution will come and because they want because it will significantly benefit the people and the government. And they were saying that the financial condition will be improved and they will be very happy to live here. And another thing is that improving disaster response system. Actually, they received some reliefs during flood in 2020, but that was not enough. And the types of reliefs what they received was not actually what they needed for their to survive those emergency period. So what they requested that we should ask them what they need, and then relief box should be arranged like that. So these are the recommendations, but I would say that whatever they were saying, all my visits to and they're talking with them, spending time with them, I found that what they want to improve their local area. They do not want to leave their area, and they love their land. And I was surprised, and it was actually it was a lesson for me too, that they were happy. They have problem. They were saying that yes, we have problem, but the most of the time they were saying that they are happy, but they have problems. So like that, so it was very important. I think that listen that for our because I work on disaster management, and so I have found that they actually need some few development works, not the which will cost a billions dollar or pound, I would say. They need and I should add here that there were flood control. The walls were there. There are some works have been done by the government, but this is not enough. They have embankments, but it's not working well. So we can improve those embankments. And riverbank erosion, for riverbank erosion also we can have some structural measures. But there's another measure. They were saying that if they can have land where they can the inland area of that municipality, if they can transfer from the just beside from that bank of river, they can move their houses in that inland areas. That would be helpful. So this is the result from my research. So we have got this result, and thank you very much for listening.
Nahid, thank you so much. That was a fascinating presentation and such interesting and important research. I think so often we talk about people who are forced to leave in the face of disaster, and it's equally so important to think about people who choose not to and why that might happen. I'm going to go ahead and stop the recording before we get into Q&A.